Hey guys, so today's topic is going to be graft versus host disease. And this is not uncommon when it comes to having a transplant. Heart transplant, liver transplant, name the organ. There will be some form of rejection, not unusual. For me, since I have ALL, acute lymphoblastic leukemia, they've been monitoring my graft versus host disease since the beginning. I've had it for years in my liver, and I've had it in my mouth really bad for almost the past 2 years. And it's also on my skin. And it's a form of rejection of my body rejecting some of the donor cells. Not uncommon. The doctors and I don't want it to get out of hand or to get worse, that sort of thing. So I went on the Leukemia Lymphoma Society website and actually pulled up some graft versus host disease information. Because anyone that's dealing with leukemia or any kind of cancer, you're going to have weird things happen to your body. I also will be showing you another website of pictures. And some of the pictures might be graphic as far as the average person is not used to seeing this kind of stuff. Whereas I live with it, the other patients live with it, the doctors see this every day. So these pictures and images are not uncommon to us or foreign to us. But for the average viewer, I am giving you a warning as we go through the video. And I will pick the pictures that will not throw anybody to a tailspin. But they will be a little bit graphic in nature, which is why we added that at the beginning of the video, that little notice. Watch this one with caution, because this is what I'm dealing with on a daily basis. I deal with this every day. In fact, the graft versus host disease in my mouth has gotten so bad that I actually have teeth that are breaking because I cannot make moisture in my mouth anymore. And the moisture in your mouth has a lot of antibacterial agents to it. Almost for 2 years, I have not been able to create that. So my mouth is always dry. If you're a client of mine, you see me carrying a bottle of water or a Spark. Got my Superman Spark today, but you always see me reaching and carrying for water constantly. That is because my mouth has gotten so dry that I can't really speak anymore. Now my teeth are starting to suffer from it. I actually had a tooth break off about a month and a half ago, biting into a sandwich. A soft sandwich, nothing crazy. So I'm actually talking with the periodontist right now. I have to have all of my teeth replaced, but that'll be another video and we'll probably get into some of that. But let me get into what graft versus host disease is. You guys are like, all right, enough rambling. What is it? So I will pull this up. And again, I will add the link in the description so you guys can actually read this on your own as well. Graft versus host disease, GVHD, is potentially serious complication of allogenic stem cell transplantation and reduced intensity allogenic stem cell transplantation. What that means is bone marrow transplant. Big fancy words for bone marrow transplant. During the allogenic stem cell transplantation, a patient receives stem cells from a donor or donated umbilical cord. I received mine from my sister, and we have a separate video coming out about that, so stay tuned. Some of the medications that you take are listed here. Methotrexate, I take. Tacrolimus, I was on for a long time. Cellcept, I was on for a long time. Corticosteroids, prednisone, I'm definitely still on prednisone. So whenever, if you follow me on Facebook and I post that I was able to take one of these medications off, this is usually the group, these guys here, that I'm referring to. I'm usually take off one or some of those as well. All right, so there are two main types of graft versus host disease. You have acute graft versus host disease and chronic graft versus host disease. Each type affects different organs and tissues and has different signs and symptoms. Patients may develop one type, both types, or neither type. I developed both types. In the hospital, I did have acute graft versus host disease. Now that I'm out of the hospital, I have chronic graft versus host disease. Acute meaning short period. Like in the hospital, I had like many bouts, like maybe 2 weeks of something, 3 weeks not having anything, 2 weeks of something, 4 weeks of not having anything. So very acute. Chronic means I've been dealing with some of this stuff, like my liver issue, for about 5 years. So that's chronic. That's a big deal, especially since your liver basically filters your blood, cleans your blood out, right? So I need to have good numbers for that. So acute graft versus host disease. This usually develops the first 100 days after transplantation. Acute graft versus host disease can affect the skin, the gastrointestinal tract, or the liver. The symptoms may include, and I do have this, a rash with burning and redness of the skin, nausea, vomiting, abdominal cramps, loss of appetite, and diarrhea. I do not have diarrhea. Loss of appetite happens once in a while, not often. No nausea, no vomiting. So that's been good. I have avoided those. Jaundice, which is yellowing of the skin or eyes, and may indicate that the GVH has occurred or injured the liver. Now, I did have this in the hospital. Doctors are constantly monitoring this, okay? I don't display any jaundice. We definitely watch my eyes to make sure I don't get any yellow in the eyes. And then the abnormalities of the liver function would be noticed in the blood test. And we didn't know about my liver stuff until we started getting back these weird readings in my blood work. I did not have any of the nausea, vomiting, abdominal cramps, diarrhea, the GI tract. I didn't have any of that. So I didn't know I was having a liver issue until we started getting all the blood work back. Chronic. I have this. I definitely have this. Here's some of the symptoms. Your mouth. Very dry mouth. Sensitivity to cold, hot, spicy, acidic foods, flavored toothpaste, carbonated drinks. I am in that category. Before cancer, and actually during the first 100 days after my transplant, I like spicy food. I used to be able to eat a jalapeno straight up, no problem. Spicy salsa, ketchup, tomatoes, love it. Oranges, anything that's got a tang to it, I really love. I can no longer eat an orange. It burns my mouth. Ketchup burns my mouth. Biting in a tomato, as long as I have it on a sandwich, it burns my mouth. I do have a mild toothpaste because anything with mint burns my mouth. I don't have carbonated drinks. I used to enjoy Mountain Dew. Not often, but about twice a month or so. Cannot do that. I mean, a sip of a Pepsi, Diet, you name it, a Sprite, a 7-Up, anything carbonated burns my mouth. Painful mouth ulcers that may extend down the throat. I have on my cheek over here on the left side, I constantly have a sore that comes and goes each week. I definitely have that. Difficulty eating. I don't have any difficulty eating, but I have to be careful with my chewing, so I'm worried about my teeth breaking. Gum disease and tooth decay, so I have that. The skin, a rash, dry, tight, itchy skin. I have that. There is my forearm. I have this also on my legs and on my torso. So I will be in long sleeves a lot and long pants a lot. One, to protect me from any kind of infections, and two, to not gross anybody out, because it is a little weird. Thickening and tightening of the skin. I have that all over my shoulders, my knees. So if you ever see me bend over or bend down, and I go very slow, it takes me a few reps to get going, but that's where I love the mace and the Indian clubs so much, because that has enabled me to create greater mobility within my body, as long as I do the kettlebell training with it. I mean, they both complement each other. Z Health complements it. So as long as I keep doing those mobility drills, I'm golden. But in the morning, I have to stretch, I gotta move. Change in skin color, I definitely have that. And a intolerance to temperature changes due to damaged sweat glands. I have that. I am constantly cold. I thought it was because my body fat was getting a little low. It's not my body fat. It's because of this. Like today, I think the high temperature for today, as we're filming this on December 11th, was 47 degrees. Normally, that would be a comfortable day for me to train people outside. Could not be outside today. Every time the wind would blow, it felt like the wind chill was like minus 20. So I trained inside today, and the clients just got a good sweat. But normally that would not bother me, so that does bother me a lot. In the summer, I love the summer. The humidity doesn't bother me anymore because I have that intolerance to heat and to cold weather. Nails, changes in nail texture. Hard, brittle nails and nail loss. I have that. My nails are trashed. My toenails look the same. Something you gotta live with. Scalp and body hair. Okay, so loss of hair on the head. I've actually had my hair grow back. So that's been going well since I was in the hospital. Premature gray hair. I've got gray, but that's just due to my age right now. Loss of body hair. I definitely have that. My arms and my legs were much hairier. The GI tract, so the gastrointestinal tract. Loss of appetite. Unexplained weight loss. And that was one of the things at my last appointment, because I've been maintaining between 155 and about 162 as far as my weight. And I want to be at about 170, 180. And that's me personally. That's not what the doctors are saying. That's just me being vain. I am not able to get there through my nutrition, through my workouts, because of the GVH and the radiation in my body. Anything I eat or drink, my cells just immediately absorb the nutrients. They're constantly going through mitosis and getting that nutrient. So loss of appetite, no. Unexplained weight loss, not really, but it's been fluctuating lately. We're keeping an eye on it. Nausea, nope. Vomiting, diarrhea, stomach pain. None of that unless I have any kind of change in my medicine, which I have had new medicine introduced, and I've had changes in that. So I do get some of that, but now I take my medicine at night before I go to bed. That way I can sleep through the symptoms, because I sleep all night, and then I wake up feeling fine. Lungs. Patients with GVH may suffer from shortness of breath, persistent chronic cough that does not go away, and wheezing. The shortness of breath I have to deal with. I deal with that now. Even with my workouts. That's why I'm always looking at my iWatch and monitoring everything to make sure my heart rate is well. But yeah, my lungs, I definitely have to keep my cardio up, and I definitely have to keep my workouts up to maintain a good, normal breath. Otherwise, I will get short of breath pretty quick. Liver, I think I covered that pretty well, but here are some of the side effects. Abdominal swelling. I did have that up until about a year ago. I had distension all across my abs. It's gone down quite a bit. My liver function tests, they've been all over, but the past 2 appointments I've had, they've actually started to level out with the new medicine, so that's good. Muscle and joints, muscle weakness and cramps. Yeah, I have that, but not only from the GVH, but also from the prednisone, because the prednisone, even though it's a steroid, and people are thinking, oh, cool, steroids, you get to roid out. No. If you're on prednisone for long term, it actually starts to eat away your muscle and eat away at your bone. So your bones can get more brittle, and your muscles are in a constant state of like a tension, and there's not a lot of relaxing, and they weaken, meaning the actin and the myosin, and we explained that in some previous videos, but the tiny little myofibrils, the myofibrils in the muscle, they actually start to deteriorate, which is another reason why exercise is so great to maintain body mobility. Like, this is one of my tests. I'm supposed to be able to keep my fingers and my hands together and my elbows out. I'm supposed to be able to do that. Constantly doing Z Health to avoid the stiffness and the fingers, the wrists, the knees, ankles. I have all that in all those joints, but I'm constantly doing my Z Health drills. Okay, I'm constantly moving, getting in my mobility drills, moving my head, turning, watching my posture. I'm constantly doing that. Fortunately for me, the profession I chose, I'm moving all day long. I'm picking up weights. I'm running with my clients. I'm running with the kids at PE. I'm having a good time. We have a great time. But if I didn't move, I would be very, very stiff. And actually, my doctor this past Thursday, she even mentioned how well I was moving. I credit that to my training regimen. There's a ton of information on the Leukemia and Lymphoma website. Now, I'm going to get to some of these pictures. Okay. And like I said, I'm just going to pick and choose the ones that are not too crazy for everybody. Looking at this guy's hands. Okay. So you see the redness and the spots all over his hands here. Okay. It looks like a rash. he's got some mild, I would say mild GVH going on here. Not too bad, but look at the fingertips. That's where you got to look at for the circulation. How much circulation is going on there, okay? Because these are distal phalanges, meaning your fingertips are furthest away kind of from the heart. So you got to watch out for that. But you see there's dryness. If you look closely in the creases of the hands, this person is experiencing a lot of dryness. It's very painful. So if you've ever had a sunburn and you're healing from a sunburn and your skin gets really tight because you've added the aloe and the lotions, and you know it's a 1st degree sunburn or a 2nd degree, and usually like day 4 you feel that tightness in your skin, it's about to start peeling. That's what it feels like all the time across our body if we have graft versus host disease all over the body. I feel that mostly in my knees and in my ankles. You see it's very dry. This would be a chronic graft versus host disease. So right here, this person has it on their tongue. They have it on the bottom and side of their tongue. They have it on the top of the tongue. So like where the taste buds and everything are, right back through here. And then on the very edge up here, he's got some irritation. So whatever that would taste sweet or salty, magnify that by like 100, okay? And if you notice his lips, he's got some cracks here along the lips. Our lips are constantly dry and cracked. So you see me a lot of times applying lotion while I'm training or speaking. And the reason for that is because my lips are starting to crack. I'm bringing this up because this was a point of, I'm making this video because this was a point of contention with me with my doctor, because I was having kind of a fed up day last Thursday. I was kind of fed up with feeling this way, and so I kind of let my doctor have it. And she was very nice and very caring, and just explained to me that this is a part of it. That's what I wanted to tell you about the graft versus host disease, that it is common, it does happen, and it does happen with your stem cell transplant. So anyone out there that has had one or is about to get one, please talk to your doctor, because a lot of the symptoms that I am discovering now, my doctors did not tell me at first. Not because they were being negligent, because they weren't sure if I was going to develop those symptoms. Like, why tell me that I'm going to develop all these really weird things if it never happens? I could have never developed graft versus host disease. It could have just stayed in my liver, and the skin would have been fine. But since I've got some the eye irritation, my eyes are dry all the time, so I'm constantly putting drops in. That's a part of it. My mouth, my arms, and my legs, I have this. So the doctors, whenever I go in, I'm like, why didn't you tell me? And they go, we would have, but you didn't display those symptoms until when I was diagnosed. So I'm just waiting kind of each time I go in to find something new with my treatment and with my medications. But right now, I'm alive, I'm healthy, my attitude is very positive. Thank you for letting me discuss in detail about the graft versus host disease. If any of you guys have any questions, feel free to email me at any time. James@woodallsfitness.com. That's James@woodallsfitness.com. I'll be happy to answer any questions about my journey with the leukemia. You guys have a great day, and we will talk to you soon.